Skin sagging on the lower face and neck is one of the most common complaints as we age. No one wants to inherit their mom's turkey neck or see their sagging jowls when they walk past a mirror. And other than wrinkles, gravity is the most common aging issue our clients want fixed. Honestly, until just a few years ago, there weren't good solutions other than plastic surgery. But a few years back, along came laser lift, or the SideLase Precision TX laser, which is the exact laser with two different names. Laser lift offers natural results that are just short of a facelift for most people, but with about a third of the cost and downtime. So if you're someone looking for the absolute best tightening and contouring along the jawline without going through major surgery, then laser lift is probably the right treatment for you. We're the first to tell you laser lift is not as dramatic as a facelift, especially if you have very loose, lax skin on the cheeks. However, it's oftentimes more dramatic than a facelift on someone who has that fullness under their chin, and the results are always natural with no scars. Other benefits of laser lift versus a traditional facelift? The first one, there's no general anesthesia, which is great because that's the biggest risk of any surgery. Instead, we numb you with tumescent anesthesia, a type of local anesthesia. Next, if you need fat reduction under your chin or in the jowl area, the laser is used to liquefy the fat before we do the suction, ensuring a gentle, smooth suction result. And the third advantage is the laser has a temperature on it. We heat the skin so that you get skin tightening, and that's really important. So here's how it works. First, on the day of your procedure, about half the patients take pain medication and something to relax them, and about half take nothing. If you take medications, you have to have a driver, someone to drop you off and drive you home. We do the procedure right in our office. After cleaning and prepping your skin, we take you to a sterile setting and we make a few small 2mm incisions, which are really just tiny punctures under the skin and toward the back of your jawline. Through these punctures, we infuse numbing medication into the neck and the lower face. And when that's done, you're completely numb. You can't feel anything. Then we use the fiber optic laser to heat under the skin to a specific temperature and to heat up and melt the fat under your chin. That heat allows the skin to tighten along the neck and lower face. Generally, you don't feel any of this because you're numb. Third, and the last part of your procedure, is the gentle suctioning of the melted fat. This all takes about 30 minutes. Immediately after your procedure, you're a little groggy if you took the medications, and you might not remember much. This is temporary, just until the medications work out of your system. We do have you wear a head and neck ACE-type wrap for gentle compression for about 3 days around the clock, and another 4 days at night only. You come into our office for a recheck about 3 days after your procedure. Honestly, recovery is really easy, but this is a minor surgical procedure, so you're going to feel a little bruised or tender. It's rare to need anything for pain other than Tylenol or Advil. By day 4, when that head wrap comes off, patients are back to work and doing their social activities. Results are noticeable almost immediately, but they keep getting better for 6 months. Fortunately, the chance of complications is really low. As with all procedures, there's some risk of infection, but we do this in a sterile, clean setting, and we put you on an antibiotic to minimize that risk. We expect you to have a little skin numbness, which goes away in a few weeks or a few months. And we can discuss any other concerns at your consultation. One thing, we can't do laser lift on smokers or on anyone who uses nicotine in any form. And there are a few medications that interfere with the local anesthetic and increase your risk of clotting. So we'll look through your medications, and we may have to stop a few of them for a week or 2 prior to your procedure. Dr. Lowe has performed hundreds of laser lift procedures, and he's worked with this laser since 2009. Obviously, like it is with all things, the younger you are, the more skin tightening you get. But we've treated people of all ages. Some people are just born with a double chin or an undefined jawline, and they may get laser lift in their 20s. And Dr. Lowe's mother had it done when she was 84. Check out her results. Take a look at our before and after gallery. I think you'll be really impressed with the results. If you have any more questions, ask away. Our consultations are always complimentary.